Have you ever wondered how a patient's gender influences anesthesia? It's more than just medications or procedures, it's about the unique ways the human body responds. Why do women sometimes react differently to anesthesia than men? And how does this impact surgical outcomes? Today, we're peeling back the layers on the intriguing subject of gender differences in anesthesia management. Buckle up as we embark on this enlightening journey, revealing the vital connections between gender and anesthesia that could change the way we think about patient care. Let's dive right into this episode of Optimal Anesthesia. Let's start with the cardiovascular system. Males typically have larger hearts and more blood volume, making their bodies more stable during anesthesia. On the flip side, females often have smaller vascular capacity, which can make them prone to drops in blood pressure, especially during spinal anesthesia. Did you know your hormones play a big role in how your body responds to anesthesia? Today, we'll dive into how these tiny messengers impact anesthesia for both men and women. For women, estrogen enhances opioid sensitivity, meaning smaller doses but higher nausea risk. Progesterone increases ventilation and lowers CO2, especially in pregnancy. Luteal phase increases pain sensitivity and PONV risk. During menopause, reduced estrogen lowers opioid sensitivity and alters drug metabolism. For men, testosterone declines with age, reducing muscle mass and cardiovascular stability, altering drug distribution. Cortisol changes in stress response may require steroid adjustments. Growth hormone decline reduces cardiac output and oxygen delivery, affecting stability during surgery. During aging, slower liver and kidney function prolong drug effects, requiring dose adjustments. Hormones shape how anesthesia works, proving there's no one-size-fits-all approach. Tailored care is key. Let's start with the airway, the most critical part of anesthesia management. Did you know that females generally have smaller airways compared to males? This isn't just a fun fact, it has real implications. Smaller airways mean higher risks of complications during intubation, like laryngospasm or airway trauma. That's why anesthesiologists often use smaller endotracheal tubes for female patients. It's not one size fits all. And here's something even more interesting. The tracheal cross-sectional area in males is about 29% larger. That's why airway resistance is lower in males, making ventilation a bit easier. But in females, higher resistance means a greater chance of hypoxia or bronchospasm during surgery. Now let's talk lungs. Did you know that female lungs are about 10 to 12% smaller than male lungs, even if they're the same height and age? Smaller lungs mean lower functional residual capacity, or FRC. This is the reserve of air left in the lungs after exhalation, kind of like your emergency oxygen supply. In females, this reserve is smaller, which can lead to issues like atelectasis and hypoxemia, especially when lying down for surgery. And it doesn't stop there. The diaphragm, that's the main breathing muscle, is shorter in females, which can affect breathing efficiency. Add a smaller chest wall, and you've got even more challenges for ventilation during anesthesia. Men tend to have larger necks. This isn't just about wearing bigger shirts. A neck circumference over 40 centimeters is a red flag for a difficult airway. Think obstructive sleep apnea, harder mask ventilation, and tougher intubation. Solution? Always assess neck size during pre-op evaluation and keep advanced tools, like video laryngoscopes, on hand. Next, let's talk about the famous Adam's apple. The prominent thyroid cartilage in men can obstruct your view during a laryngoscopy. A video laryngoscope can be an invaluable tool in this situation. And remember, Proper positioning, like the ramped position, can make all the difference. Here's something you might not think about. Men have longer tracheas and a steeper glottic angle. What does this mean? It can make passing the endotracheal tube a bit trickier. A bougie or flexible bronchoscope can help you navigate these challenges smoothly. Men also tend to carry more fat around the neck, especially if they're obese. This can make mask ventilation and airway sealing a challenge. Pro tip: optimize patient positioning and always have a backup airway plan. The ramped position works wonders here too. And don't forget about anatomical surprises. Men are more likely to have things like deviated septa, hypertrophied tonsils, or even rigid airways. A thorough pre-op airway exam is key. When in doubt, consider imaging or extra planning. Tailoring anesthesia to account for gender differences is just the beginning of providing safer, more effective care. In today's episode, we covered a few key differences in how men and women respond to anesthesia. But there's so much more to explore. In the coming episodes, we'll dive deeper into other aspects of gender differences in anesthesia practice, including how hormonal cycles, pregnancy, and age impact anesthetic management. If you found this video insightful, don't forget to like, subscribe, and share it with your fellow healthcare enthusiasts. And remember, the art of anesthesia lies in understanding the unique science behind every patient. Stay tuned, and see you next time on Optimal Anesthesia Insights.